So if you don't know which foods is triggering the autoimmune attack and you're constantly eating it and it's a war zone in your gut, Candida's going to keep coming back, my friend. Infection really is important as a consideration and one of the feeders. But the order with which we approach infection first is wrong. I'm going to make this point again, and I'm going to hope you guys can understand why I'm saying it. The order with which we attack infection in those with autoimmune is wrong. And I'm going to give you plenty of examples. So let me give you an example. How many of you have SIBO? How many of you have Candida? How many of you had it over and over and over and over again? Okay. And yet, when you go see a naturopath or functional doctor, that's usually one of the first tests that's done. And that's usually the first focus. And I think I know the order is wrong because here's why. When you look at the 5 pillars of transform, right? I think about it this way. Let's say you go see a naturopath or functional doctor. You said, oh, you have SIBO. They kill it. And then it comes back over and over again. Years and years of this, cycles and cycles of this. How many of you have had that? Well, only to find out they still have it, keeps recolonizing, and the autoimmunity is no better or even worse. This is the common scenario of most people that are joining our programs. And it's not that approaching infection is a bad idea. It's that there are things that you need to do first before you're able to effectively address infection and to prevent recurrence. And that's the 5 pillars. So give you an example, which is one of the pillars is blood sugar mastery, which means you're preventing high and low blood sugar. And here's the deal. Every time you reach high blood sugar, you're feeding the infection. Every time you drop from high to low blood sugar, you're feeding the autoimmune attack back and forth all day long. So if you don't have blood sugar mastery, it doesn't matter what IV or what supplement you're using to kill that infection, it ain't going away and it's coming back over and over again. Secondly, a lot of these infections live in the gut and they love a broken gut. That's a war zone. So, example, if you have a candida infection in your gut, how many of you had it come back over and over again? Because the environment is what the candida loves. So, what are we doing to change that environment before you could even attack the infection so it never comes back? Food mapping, digestion. These are pieces of our pillars. So, if you don't know which foods is triggering the autoimmune attack and you're constantly eating it and it's a war zone in your gut, candida is going to keep coming back, my friend. It's going to keep coming back. If you don't understand the role of digestion as the first line of defense against infection, which no functional doctor is discussing in autoimmunity. Nobody's teaching people about the role of digestion, which we do in our program. Okay. And if you're an alumni watching, how much has digestion really improved your autoimmune disease? Right. So here's the thing. If you're not properly digesting, the food is fighting your gut to get broken down and absorbed. It's a war zone. So guess what? Infections come back over and over again. So for me, it's really important to do the work to actually clean up the environment that's in your gut by no longer eating the allergens, by having blood sugar mastery, by having optimal digestion. That way, guess what? There's nothing good for candida to come back to. There's no cheese up that tube. Candida can't come back to an environment that's healthy and thriving. It loves a war zone. So this is a lot of topic and discussion around super infections, but also other what I call opportunistic infections. And I think it's really important to take a perspective of, making sure that if you had a history of infection, don't jump to that first. Right now is what you should be dealing with. Okay. That should be last. What you should do first is clean up the environment by working on food mapping, blood sugar mastery, as well as digestion. That's going to optimize the environment, making it impossible for some of these organisms to come back. So I tell everybody that our program is naturally anti-infection because every week over the course of 2 months, you're actually going to be fighting infection. Because what does it take to fight infection? Removing the food allergens, better digestion, better hydration, balancing your blood sugar, right? So every week, our clients in our program are seeing less and less symptoms of autoimmunity. And at the same time, they're lowering their infection load. So this is really something important to understand. So that order is really important. And I see people looking at the pyramid, like let's say at the top of this pyramid, the goal of this pyramid is to kill an infection. Well, they're just focusing on this tip of the pyramid and they keep knocking on the tip of this pyramid for months, years, or decades, when really the bottom work layers is what's needed to get to the point where you can say, oh, do I even need to address infection anymore? That's the beauty of this. Okay. Dana says, do you think IVIG can help reset your immune system after being triggered by serious past infections such as Lyme, EBV, or SIBO? Dana, I just addressed this, which is that, again, that's just another band aid. Temporarily giving antibodies doesn't resolve the issue that the environment in your gut is basically a party platter for all these infections. So people could be like, can this supplement help with this infection? Can this help with that? Can antibiotics help with this? Well, yeah, of course. Any of these things can help decrease uh, amount of infection that you have. But the problem is they keeps coming back. So it's like a gravy train that recycles itself. I tell people that when I had a clinic practice, that one of the things that I would address with people was the role of infection, right? But the problem was in the clinic setting, people kept coming back over and over again. We got rid of the infection, it would still keep coming back over and over again. I was working with people on SIBO, Epstein-Barr virus, with Lyme, all that, but it kept recurring over and over again. This is also why this program was born, because I finally recognized, which is I'm just doing a recycling system with people. And how can I break the cycle? Oh, we need to change the environment in the gut that is causing the autoimmune disease and the infection to be there in the first place, which is why multiple pillars in our program address these points. Now, if this is making sense with you and you're like, what the heck are the 5 pillars? I want you to type in the comment section 5 pillars, because you got to watch what the 5 pillars are that are triggering autoimmune disease. What I want to do is bring my 26 years of experience dealing with my own autoimmune disease and thousands of people's of autoimmune disease to just tell you what my experience is and what I know to be true, which is not only is the content of what you do for your autoimmune disease matter, but the order really matters. If you don't have the right content of what to do, and then you don't do it in the right order, you're spinning your wheels, wasting a lot of time, money, and opportunity. And meanwhile, autoimmune disease doesn't have a stop button. It's continuing to cause more and more and more permanent damage, right? So it's really important to not hyper focus on something that should happen at the end, which is where am I with infection? And focus on what are the order of the right things that I need to do in the first place. Order really matters, and I address it in the 5 pillars. So if you want to watch the 5 pillars, write 5 pillars in the comments. A member of our team will send a message to you. I hope that was super helpful. All right, everybody. I think that's a wrap. Now, here's the thing. A couple things. Everybody that commented here, okay? Everybody that commented here today in today's comment section, later on today, check your message requests. There's probably going to be some questions from our team and some resources that are going to be shared with you. We're also putting a link here. If you want to chat with us, go ahead and just click that link and chat with our team. We have someone who's ready to chat with you about any questions you have about the Live Edge Escape or any information about our program. All right, everybody, have a wonderful day.